Malignant pleural mesothelioma, MPM, is an aggressive form of cancer that develops from the mesothelium, the protective lining that covers most of the internal organs in the body. While surgery, chemotherapy, and radiation therapy remain the standard treatment approaches for MPM, there are a number of alternative treatments that some people explore as complements to mainstream therapies or in place of them. It's important to note that most alternative therapies for MPM have not been scientifically proven to be safe or effective, and should be discussed with your doctor given potential drug interactions or side effects. With that said, here are some of the alternative treatments sometimes considered for MPM. Nutritional and herbal therapies. There is some research looking at nutritional and herbal therapies as potential complementary approaches for MPM. For example, dietary supplementation with antioxidants like vitamin C and D, carotenoids, and flavonoids may help reduce oxidative damage caused by chemotherapy and radiation. Turmeric contains the active compound curcumin, which has been found to inhibit cell viability and induce apoptosis in mesothelioma cells in preclinical studies. Green tea and resveratrol from grapes also contain antioxidants that may offer protection. Mushrooms like shiitake, reishi, and turkey tail have immunomodulating properties being studied for their effects on mesothelioma. Herbs like ginger, holy basil, ginseng, and astragalus are commonly used in Chinese and Ayurvedic medicine to boost immunity and help with side effects. However, none of these have been proven as effective treatments when used alone. Acupuncture and traditional Chinese medicine, TCM. Acupuncture aims to stimulate energy flow through the body by inserting thin needles into specific points. It is sometimes used for pain management, nausea, or fatigue associated with MPM. TCM takes a holistic view and may incorporate acupuncture along with herbal medicine, massage, diet, and lifestyle advice tailored to each person based on TCM diagnoses. Again, there is no conclusive research showing acupuncture or TCM can directly treat the cancer itself. Hyperthermic intraperitoneal chemotherapy, HIPEC. This experimental approach involves surgically opening the abdominal cavity and bathing it in a heated chemotherapy drug solution, aiming to destroy any residual mesothelioma cells remaining after surgery for localized disease. Studies are still limited, but some report a potential survival benefit when combined with cytoreductive surgery. However, it is a complex procedure with risks of side effects and may only be appropriate for certain patients with early-stage disease. Targeted drug therapy and immunotherapy. Newer experimental treatments in clinical trials test targeted drugs that interfere specifically with molecular pathways driving mesothelioma growth and spread. For example, inhibitors of vascular endothelial growth factor, VEGF, or Epidermal Growth Factor Receptor, EGFR, pathways. Immunotherapies try to stimulate the immune system to better recognize and attack cancer cells, such as immune checkpoint inhibitors targeting proteins like PD-1 or CTLA-4. While promising, more research is still needed to determine safety and effectiveness. These may become standard options in the future. Electrotherapies. Therapies involving electromagnetic fields or electrical current are sometimes explored, including electromagnetic hyperthermia, photodynamic therapy, or treatment with alternating electrical fields. The idea is that certain frequencies may inhibit tumor growth by interfering with cell division or boosting immune response. However, there are no large trials confirming usefulness for MPM specifically. Side effects can potentially occur and interactions with other treatments are unknown. Supplements, drugs from other medical systems, plants, supplements or unconventional drugs used in other medical traditions sometimes gain interest, such as mistletoe from European anthroposophic medicine or Haeila 951 from traditional Chinese or Korean medicine. However, most lack research directly relating to MPM or demonstrating safety and efficacy when used alone or with conventional care. Careful consideration of risks versus benefits is important before usage. Energy therapies. Therapies like Reiki, therapeutic touch, or Qigong involving manipulation of biofield or life energy fields are sometimes turned to for MPM symptom management. However, There is little scientific understanding of how they might work and no clinical evidence they can treat the underlying disease. Other types of energy medicine including magnet therapy, color light therapy, or sound vibration therapy also lack research to substantiate use specifically for MPM. Faith, spiritual healing. Some people seeking alternative options explore spiritual or faith healing practices involving prayer or rituals intended to promote healing through non-physical means. While these can help alleviate stress or boost hope, they have not been shown effective as direct cancer treatments when used alone without conventional care. For most, integrative care including mainstream and complementary therapies chosen with physician guidance may be a reasonable option worth considering. While alternative therapies are commonly explored, especially as supportive care, current evidence is lacking that any can treat MPM or prolong survival as monotherapy. They carry some safety risks if interfering with standard treatment or delaying evidence-based care. When chosen, integrative options are best discussed openly with your medical team in the context of your personal health history, values, and treatment goals. Careful research is important before ceasing or reducing conventional therapy. Immunotherapies, targeted therapies, and experimental approaches like HIPAC are more promising as they align with medical understanding, but require further validation.